look internationally now. India, third in the list of countries worst affected by the pandemic. While the government there says it's providing support to all affected, hundreds of patients are reported to have been turned away from hospitals due to a lack of beds. Now those who can afford it are looking at other options, such as being treated privately at home. Nitin Srivastava reports.
A residential apartment block in a wealthy Delhi suburb. It's home to more than 600 people and an isolation ward for Covid-19 patients. The government has increased bed capacity, but patients like Mr. Mehta prefer their own facilities like these.
After testing positive, I went to a government hospital, but decided not to get admitted because of the excessive crush and overcrowding. We didn't panic as a family and opted for home isolation with a mini ICU kind of setup, which really helped me.
This is an oxygen concentrator which provides you oxygen for 300 hours non-stop on power backup. This is a cardiac monitor which is right now monitoring my oxygen levels, my blood pressures and all other vitals. And this is a ventilator for a worst case scenario. Treatment in your own home is done by a nurse under the supervision of a doctor. Nurse Vorsemla recognizes that it's a big responsibility being the only medical professional in the room.
At home, the doctors are not available physically, so the nurse should be competent enough to handle the critical situations and should be able to prioritize the things like when to communicate the doctors and how to communicate it.
This service comes at a price. At $150 to $200 per day, these mini ICUs aren't affordable for the majority of Indians. But demand is rising.
The demand is very high. Every day, currently around 5 families, it means that we are boarding the 25 to 30 patients every day of COVID, and we are taking the next patient with the waiting period of 24 hours.
The government allows only asymptomatic or patients with mild COVID symptoms to be treated at home. But whether you are actually in your home or on a ward in a private apartment building, it can be risky.
If somebody says that I have converted the community center or a gymkhana or a center in the community area into this ICU, or we have converted into the COVID care center, there the only problem would be that there won't be a medical personnel to monitor these cases. If there are 10 patients, if something happens, then who will be responsible?
Whilst buying services like home ICU and isolation beds is becoming more popular amongst India's elite, the majority of patients do not have that option. Nitin Srivastava, BBC News, Delhi.